So I'd like to welcome Harpreet Kalsi-Smith, who is talking to us about the importance of using our voice. Will you be singing through your PowerPoints? Harpreet, marvellous, that's great. And like me, Harpreet comes from the Yagambeh speaking peoples of the Gold Coast. Would you like this? Okay, thank you very much.
Thank you, Jo. Right. So before I commence, I'd like to acknowledge all of you in the room. Oh, sorry. Is that better? Yeah, okay. And online and all that you carry, because death and dying touches each and every one of us. And I know in my experience, which I'll share with you, but also that of so many of you, we're in this space because of personal experience and what we carry. And I also want to pay my deep respects to the Yagara and Turrbal people of the lands from Brisbane, and they're the lands that I've been raised on. And to my dear mum, Rani, whose death sparked my deep commitment to working with and in community to reclaim death and dying. So Jo's already spoken about the Lancet Commission's report on the value of death, so I'm not going to spend too much time on that. But I think I'll just draw your attention to the quote here where it says, "Death, dying and grieving today have become unbalanced. Healthcare is now in the context in which many encounter death, and as families and communities have been pushed to the margins, their familiarity and confidence in supporting death, dying and grieving has diminished. Relationships and networks are being replaced by professionals and protocols." So I've been working as a consumer advocate and end-of-life doula in between community health and palliative care for a number of years since my mother's death in 2016. She was diagnosed with idiopathic pulmonary lung disease, and we were soon told that there was no suitable treatment to prolong her life. While she was sick, I wondered, where's the book or the guide to help me support my mum and my family through her end-of-life journey? I was provided with endless brochures and website links, but when you're in the throes of anticipatory grief, your ability to process vast amounts of information slows, and simple and practical is what we needed. There are many times along this map and journey that a compassionate community would have aided my mum's end-of-life experience and also ours. And credit goes to the Healthcare Improvement Unit, the Queensland Health, for designing this journey so well for me. So since that time, I've had the privilege of supporting carers, individuals, and building community capacity to become more comfortable in speaking about death, dying, along with creating spaces for collective grief and collective healing. I'm going to share two experiences that have stayed with me when it comes to the question of why we are here today. One was shared with me and my colleague Linda Curdy on a proactive community connection project that we undertook on having conversations with friends and friends of friends to identify their needs and to normalise conversations that count about end of life. It reads, "Can you get us talking about what actually happens when a person dies? And are they different ways of dying? Is it heart failure, lung failure, or a stroke? What happens and what are the signs? What does it look like? I don't actually understand because no one tells you. I don't know whether he died because he couldn't breathe anymore or because the morphine did him in. Like, I don't actually know how he died." And this friend was talking about the experience he had with his own dad. Just last week, I was in Harrington, a little coastal town on the mid-north coast of New South Wales on Biripi country. We were having a yarning circle on the needs of elders as they age, which includes sorry business and end of life. It was Uncle Les's 76th birthday that evening, last Tuesday, and he said to us, "No one wants to see me. I feel really lonely and isolated. I wish that someone would just come and have a cuppa with me, to check on me from time to time." Uncle Les doesn't have an advanced care directive. He doesn't have a will or enduring guardian. But what he was really saying is that he wants a connection to a community that is compassionate. I wanted to share these two examples with you, along with my own, to bring home what my colleagues have so clearly articulated the need for, which is for us to come together, regardless of profession, sector, or interest in this space. Death and dying transcends all the structures and processes we have built. It is a fundamental time in life where the right to be holistically supported socially, emotionally, physically, and spiritually to enable people to die with dignity, compassion, respect, and most importantly, kindness is essential to honouring the human experience. And so at the heart of the work of compassionate communities primarily sits in compassionate community development. Community development requires relationship building, trust, collective action, and collective leadership. It is based on acts of kindness and compassion and a sharing of load, resources, and a coming together. It takes time, sometimes a long time. For our societies to be compassionate at end of life, they must be built to be compassionate at all stages. Many of you have heard the term community development, and so much work has been done in the space of community development and compassionate communities. But for those of you who are newer to the concept, the United Nations defined community development as a process where community members come together to take collective action and generate solutions to common problems. I would argue what we are facing in Australia around death and dying and ageing is not a common problem, but an emergency. There are a number of principles that lay a foundation for community development, including self-determination, collective action, and collective leadership. Community development seeks to empower individuals and groups of people with the skills they need to effect change within their communities. The structures and processes of the world we live in dictate a largely top-down approach to the identification of problems and solutions. Thought leader Cormac Russell and practitioner in community development provides a really compelling view on what sustainable community development looks like. He challenges us to look at the strength within our communities and not just what's wrong. And I'm going to play a brief segment from his talk.
Thank you. The question, can I help you, is a question that millions of people ask millions of other people every single day. What does it actually mean to help another human being, or indeed to help an entire community? I believe that helping is a powerful and often beautiful human impulse. But I also believe that helping has a shadow side. That certain styles or forms of helping are actually doing more harm than good. Rosabeth Moss-Kanter, the Harvard academic, puts it beautifully when she says that when we do change to people, they experience it as violence. But when people do change for themselves, they experience it as liberation. Today, I want to present a very simple idea. And the idea is this. If we want to help people in a way that does no harm to them and their capacities and their communities, then the best place to start is with what is strong within them and within their communities, and not with what's wrong. There is an abundance of evidence that calls us to this way of helping, including the 75-year study on what makes happiness possible, the longitudinal study from Harvard, which reminds us that it's best to lean into our relationships and to create community rather than lean into ourselves and money. And the work of the Kettering Foundation, which studies what happens when democracies work as they should. And indeed, here in the UK, the work of the New Economics Foundation, which has helped us to see the 5 ways to well-being. Still, despite the fact that thousands and thousands of pieces of evidence call us to the idea that we should start with the capacities and the abilities in people and in communities, we see this great preponderance in governmental and non-governmental programs alike around the focus and the obsession with the starting on what is wrong, what is broken, what is pathological within people. Sadly, that focus has caused huge harm to millions of people around the world, especially poor people and especially communities. And it has created 4 harms, unintended as they may be in particular. The first of which is it actually takes people who we're trying to help, and it defines them not by their gifts and their capacities and what they can bring to the solution, but by their deficiencies and their problems. The second unintended consequence of this top-down obsession with what's wrong is that money, which is intended to go to those who need the help, doesn't. It actually goes to those who are paid to provide the services to those who need help. The third unintended consequence is that active citizenship, the power to take action and to respond at the grassroots level, retreats in the face of ever-increasing technocracy, professionalism, and expertise. And finally, entire neighborhoods, entire communities that have been defined as deficient start to internalize that map and believe that the only way that anything is going to change for them is when some outside expert with the right program and the right money comes in to rescue them. These are unintended harms. No caring professional wants these things to happen, but it's also clear that no community needs these things to happen.
Cormac Russell has so clearly stated what we need. I wanted to share a story of what community relationship building here may look like. When I first started with working with First Nations people of this land, it was way back in 2012 when I was at the Aboriginal Health and Medical Research Council. I had a wonderful manager, and she said to me, Harp, for the next 5 months, you're going to go out with our team. You're going to go to a range of communities. You're going to say your name. You're going to sit there and say nothing else. You're just going to listen. It was deep listening and relationship building. The next time I went out, community remembered my face and they opened up a little more. And slowly, relationships were built. It takes time to build those relationships and trust, especially if we're talking about creating sustainable support. I don't know how many organisations in this day and age would encourage their staff to do that, and I challenge them to do it, because that's the only way we'll be able to make a step forward, is actually saying, go, have a cup of tea, and nothing else. It's not a transactional relationship. There's a lot we can learn from our Aboriginal and Torres Strait Islander brothers and sisters when it comes to the creation of compassionate communities. And there's a reason why Aboriginal community-controlled organisations exist and why community control is important. That is, organisations that are run for and by the people they serve. At the heart of it, community-controlled organisations ensure needs are met because the needs and solutions are identified by community, but moreover, just like Cormac said, they are implemented by the community, as well as with the support of others. And in a world that's increasingly transactional-like, business-like, give and take, we need to create room and space for everyone to come together, all sectors, all people, to work collaboratively with communities at the core. Wonderful toolkits and guides have been developed by the Groundswell Project, now under Provida, and Palliative Care Australia, that provide advice and guidance on community development in the creation of compassionate communities. There are many people at the community level, from community activists, leaders, innovators, workers, advocates, doulas, people creating networks in all parts of this beautiful country who have worked tirelessly to create compassionate spaces and places for community, and others who are quietly and bravely starting their own conversations and acts of compassion and kindness in their own neighbourhoods. From hosting death cafes to Dying to Know Day events, to film screenings, to picnics in the park, to death expos, to the use of performance arts and conversations with kids. The work is undertaken by community members using their voice to undertake compassionate activities that connect communities. We hope with the creation of a national hub, all the wonderful work that has and continues to occur can be shared, and there's a place for support and sharing. And importantly, for those wanting to create compassionate communities but not really knowing how to, there is support. I know that I was in need of support. It's not easy planning and organising community events, fundraising, and volunteering many hours, even with the support of wonderful, passionate people. For death and dying to be reclaimed the community where it rightfully belongs, it requires relationship building with all parts of society, and then slowly and gently opening conversations, being inclusive of everyone within our communities, and building the capacity for communities to know each other, trust each other, and then support each other. Using our voice is not always easy, but I ask you to be brave and to use yours, to take a step to connect and focus on acts of kindness and compassion in your community or your workplace or wherever you find yourself. So collectively we can afford compassion to each other and then build compassionate towns and cities across the country. That's our hope and vision. We don't have all the answers, but with the challenges that we faced individually, locally, nationally, and globally, there has never been a more urgent time for us to work together and join forces and work in a way that is kind and compassionate with the communities that we are part of. After all, we are all just walking each other home. Thanks.